Hi there, I'm Dr. Phelan. Welcome to Discover What's Possible. And with these videos, I'm sharing with you different clinical cases I've treated in my practice so you can discover what's possible with modern dentistry today. And for today's case, I'd like to share with you one of my favorite cases from the last few years, which is a rehabilitation case I treated for a patient with severe tooth wear and erosion that I treated with porcelain restorations. We did a few composite restorations as well to fill some erosion spots on the upper, but for the most part, we treated this patient with porcelain restorations. And if you look, here's the before picture, and here's the after photo. You can see the huge difference in the overall smile design as well as the incisal edge position of the teeth. If you look at the lower back teeth, you can see how worn down and eroded they were. And this treatment managed all of that by opening the vertical dimension and creating room for me to have the room for restorative material, the restorations. Here's a picture of the provisional restorations. This is an important step in testing this change to the vertical dimension of the bite, and also to test out the new incisal edge position or length of the teeth. So we want to test out that new edge and make sure that that is good for the patient in the full smile view. Doesn't really matter what it looks like with the gums and lips. So with the lips retracted, it's more important, what does this new incisal edge position look like with the lips in place and the patient smiling. So that's the most important view for our patients. For us as clinicians, if you're a clinician watching this, we get really involved with the micro aesthetics, but for the patient, the macro aesthetics are the most important thing, visually at least. So this case, we used a combination of different porcelain restorations. The porcelain restorations were built by master ceramist Harold Heindel out of the Seattle area. And we used a combination of porcelain veneers, porcelain occlusal veneers, I guess you could call them, or onlay veneers, some porcelain crowns, and some porcelain, what we call veneer or glove crowns. So each tooth was kind of treated individually based on the needs of that tooth and the needs of the restoration as a whole, the reconstruction as a whole. So we needed to open the vertical. So I had to add occlusal or tops to the teeth on the lower. And then the upper, I didn't have to treat all the teeth because we opened the vertical mostly with the lower. And because we were opening the vertical, some of the teeth could just get new tops on the teeth to build up the height of the teeth so we could open the vertical. And that's a conservative restoration. We try to make the most conservative restoration design that will get the job done, because I talk about this to my students that what we want is, I'd like to have strong tooth versus strong restoration. So I want the tooth, when we're finished preparing the tooth for restorations, to be as strong as possible. And I'd rather sacrifice some thickness or strength to the restoration as opposed to sacrificing strength in the remaining tooth structure. Because you can always replace a broken restoration, but if the tooth actually fractures severely because you over-prepared it, you can't replace that patient's then needing a dental implant. So we always go strong tooth versus strong restoration. And you can see in this image here, these are pretty thin porcelain restorations. And this is only accomplished through the ability to bond the restorations to the tooth surface. So we used a combination of what's called immediate dentin sealing and just overall enamel bonding. So a lot of these teeth were bonded directly to enamel, but where that wasn't possible, we bonded to dentin using an immediate dentin sealing technique. And this allows us to get all of the eroded areas where the dentin was heavily exposed sealed properly and bonded to for a long-term rehabilitation result. These are the upper restorations. We only did from first bicuspid forward because that's where the erosion was very significant. And it was very significant on the tops of the teeth and the insides. So I had to make restorations that covered all those surfaces with porcelain so we could restore the tooth with porcelain, where the enamel was worn completely off. There were some teeth that had mostly smaller areas of enamel wear from erosion, so I was able to do those, treat those areas, the upper molars and second bicuspids, with a little bit of additive bonding, so white filling material. I didn't have to go to porcelain for all of these teeth. This pattern of wear or erosion was caused by Coca-Cola drinking. So Coca-Cola is very acidic. There's a lot of acidic drinks out there. It's one of the most acidic, and that if used long-term for many, many years and every day for many, many years, that can cause this level of severe erosion. So here are the final porcelain restorations. Again, these are what we call feldspathic porcelain, so they're layered kind of in an old school design on these stone models. They're not digitally designed and milled. I think that these are the most beautiful restorations I've been able to make over the last 30 years in practice. Just this old school technique that's really not that commonly used anymore gives us the best, most beautiful looking restorations. You can see this after photo again. These restorations look like teeth. And some side views. Here's the before and after side view. You can see what we did was we improved the arch form because the teeth had some crowding and movement as they wore and eroded. So I evened out the arch circumference to make everything look more natural and more appealing and more ideal. Here's another view. And you can also see how well the restorations match the surrounding teeth. We didn't treat the lower incisors. They had too much crowding to treat with veneers unless I basically prepared the teeth so excessively it may have mutilated them. So I suggested maybe I'll just reshape them and bleach them, and that's what we did. Or I suggested actually, if the patient was interested, to do orthodontics to straighten those teeth, but she didn't really want to get braces or Invisalign, so we decided to go with just reshaping and bleaching because I didn't feel that I could effectively porcelain veneer these teeth with that amount of crowding. So we left them and it looks fine. You know, the patient's happy with this result, even though we didn't treat the lower 4 incisors. And another view, you can see how we've kind of opened the whole bite, and this allows us to have room for the restorative material because the inside of these upper teeth, they were touching and they were completely eroded into dentin. So I needed room for the restorations to build these restorations because again, I want strong tooth. I'm not going to prep the inside of those teeth that are already worn down and lost their enamel, because that would make them significantly weaker and potentially teeth that would break and end up needing to be placed implants. So we've made this as strong a tooth preparation as possible by opening the vertical and gaining room where I just added enamel to the back of those teeth where they were eroded severely. And so another view with the open view, you can see how I kind of reshaped the lower incisors to make them a little more appealing, and we bleached them to make them whiter. And then another close-up view of the upper, before and after of the upper, and another really close-up view about 4 to 6 months post-treatment of the upper. You can see in this view the gums have filled in a little bit, because when I first put in the restorations, the gums need to kind of fill in and contour around the porcelain, and I do find that this layered feldspathic porcelain has great tissue or gum adaptation to it over time. I watch my patients' treatments and photograph them extensively over years, and I can see how well the gum matures, fills in, and looks around feldspathic porcelain restorations. So once again, this is Discover What's Possible. If you're a potential patient in the GTA, the Greater Toronto Area, you know I'm in Oakville, Ontario, which is near Toronto. You could go to phelandental.com and take a look at my website and give us a call. We'd love to talk to you about your restorative dental needs if you're looking for this kind of dentistry. If you're a dentist looking to learn about how to treat patients like this, I'd invite you to go to phelandentalseminars.com and maybe sign up for one of my clinical training webinars. So that's about it. Thank you very much, and we'll talk to you soon. Take care.